Our today's presentation is on another important topic, which is called the role of D-dimers in the diagnosis of pulmonary embolism. D-dimers are often taken as a sole marker for excluding or including pulmonary embolism, but that is not the case because D-dimers are actually derived from the degradation of the fibrin, and that can be elevated in a number of conditions like infective process, inflammatory process, even the malignancies and the advancing age and the pregnancy. So the D-dimers, if they are taken as a sole markers for the determination of the pulmonary embolism, that is actually confusing. The second thing is the diagnosis of pulmonary embolism is often clinical, and the clinical diagnosis is more stronger as compared to a lab parameter which is elevated in a number of situations. That is the reason that the D-dimers have a negative predictive value which is very high for pulmonary embolism. If that is determined by the ELISA method, if it is measured by the ELISA method, so the negative predictive value for the pulmonary embolism is 99%, while the specificity of the D-dimers for the determination or diagnosis of the pulmonary embolism is 30 to 75% based on different methods of determination of these D-dimers. So D-dimers should not be taken as the sole parameters for the diagnosis of pulmonary embolism. Apart from this, what is the level of pulmonary embolism? What is the level of the D-dimers which should be considered as significant for the suspected pulmonary embolism? So in many studies, in majority of the study, a level of D-dimer of 500 nanogram per ml is taken as the cutoff value for whether to exclude or include the pulmonary embolism. So how do we interpret this value? This value of the D-dimers must be interpreted in the context of modified Will score. Modified Will scoring that states that if the modified Will score, if the D-dimer level is below 500 nanogram, if the D-dimer level is below this level, the possibility of the pulmonary embolism is very less likely. But if the D-dimer level is more than 500 nanogram per ml, the possibility is there that the patient is probably suffering from pulmonary embolism. So it has been applied in conjunction with the modified Will score. For example, before going to the level of the D-dimers, we must clinically calculate the patient's modified Will score. That has already been described in another lecture. So modified Will score. If the modified Will score is 0 to 1, which is called the low probability, or if the modified Will score is 2 to 6, which is called the intermediate probability, right? In this context, if the modified Will score is low or intermediate, get this test done. If it is elevated, the patient must be investigated for pulmonary embolism. In the context of low or intermediate probability of the modified Will score, get the D-dimers done. If that is above this 500 nanogram per ml, the patient must be evaluated for pulmonary embolism. Now, there is another scenario. If the modified Will score is more than 6, if the modified Will score is more than 6, which indicates high probability. Now, there is no role of these D-dimers. For example, a patient who has a modified Will score of more than 6 and you get the D-dimers which come out to be 200 nanogram per ml. So what is the next step? Forget about this value. This is the hard sign. Because the score is high, the patient must have pulmonary embolism. So this has nothing to do with a case who has a high modified Will score. But in cases when the patient's index of suspicion is low or intermediate on the basis of modified Will scoring, the patient D-dimers must be carried out. A level of more than 500 nanogram must prompt someone to look for the pulmonary embolism. Or in case of low or intermediate probability, if the patient modified Will score, the patient D-dimers level is less than 500 nanogram, forget about the pulmonary embolism. The patient is very unlikely to have pulmonary embolism, and think for the patient's presentation to be because of some other reason like pneumonia, like exacerbation of COPD, like exacerbation of bronchial asthma, like acute bronchitis, or in elderly patients, you may also think about the acute cardiac injury. So this is actually the value of the D-dimers in the evaluation of pulmonary embolism. Thank you very much.